Stein has a father. I don't know what his name is. But Ben Stein's father said that unsustainable trends are by nature unsustainable. And I think that's the good news that we have here looking forward here is that we can't continue to go on as we are. It's just not going to happen. We've got a $1.4 trillion deficit projected for this year. If we want to get serious about our deficits in Washington, it's going to come in the end by passing a balanced budget amendment. Because I don't believe you can trust Republicans or Democrats over the long term to be fiscally responsible with our tax dollars. Here's why I say it. We've had Republicans and Democrats over the last 20 years say, send me to Washington, we're going to balance these budgets. And over time, nobody's able to get it done. Republicans from 2000 to 2006 increased spending 36%. Democrats in the last 2 years, a spike in spending 20%. We've got to pass long-term a balanced budget amendment with a supermajority to raise taxes so that we know, you and I, the taxpayer, that regardless of who's in Washington, our tax dollars are going to be protected. We also need to reduce spending levels back to those 2008 levels. If we remove that 20% spike, and a lot of that came with all these bailouts and stimulus that were passed, we will be able to grow our way out of this deficit, because with every 1% growth in the economy is $450 billion that comes into the federal government without ever having to raise a tax on an American citizen. And that's what we need to do. Create that atmosphere by which jobs can flourish, by which small business can get out there and do what they do best, which is to grow the economy, restore confidence to our market, and let people know where they stand. I do have to leave in a few minutes. I think I'll be around for a question or two, but if I don't get an opportunity to say it, it's been a pleasure talking with you today. I've got a phone number on the information you all have in front of you. I'd be more than happy to talk with you, because on September 14th, in 4 days, I'd very much appreciate your vote. Thank you.
I'm going to respect your time. I'm going to get you right back up here.
All right.
A number of the questions have to do with health care. Just some of those, will you repeal the national health care bill and not just rework it? Will you repeal the bill? We just got our renewal on our health care bill, and it's up 43.6%. Wow. I'm in that business, so I can understand. I see Chris Hansen in the back. We have to give a lot of bad news to our clients, don't we, Chris? There's easy answers to this question, like I don't like it, but if you were king or queen for a day, what exactly? Not just I don't like it, I would change. What would you do if you're king for a day? What would your health care bill look like?
Well, how about instead of king for a day, congressman for 2 years?
There you go.
Well, just let me say quickly, I don't like it. That being said, we've got to do 3 things as it relates to Obamacare. We've got to repeal, replace, and reform it. A lot of people are saying, let's just repeal that bill. To repeal it and not offer a reform package sends the wrong message, because there are things that we can do to make health care more affordable in America. We have to repeal the bill, even knowing President Obama is going to veto it, because the American people have to know that we've got the guts to repeal it. There's no confidence out there that conservatives are able to do this, and that's why in this next session we will repeal the bill to show the American people that we've got the confidence to do it. Not only that, we're going to pass a reform package, and this directly answers your question, to deal with the affordability of health care, because that's the key. Now, the Congressional Budget Office ran the numbers on a plan similar to what I'm about to describe, where you had transparency, not only in services but in premiums, where you had tort reform. You know, the one thing that is missing in Obamacare is any sort of medical malpractice reform. But a plan that includes tort reform, and a plan that allows insurance companies to compete across state lines, which they're currently unable to do. And the CBO, a nonpartisan Congressional Budget Office, said if you passed a plan like that, that puts the patient in the center of their health care, in the driver's seat, it will reduce health care premiums 7 to 10% for small businesses and individuals by 2016. That's the right direction, a reduction in premiums of 7 to 10%. Obamacare, the same CBO estimates, Obamacare will raise your premiums 13% by 2016. That's a difference of 23%. We know what direction we need to go in health care. Now we just need to get the right representatives out in Washington who will fight and advocate for that, and that's what I will do. Fight to repeal Obamacare and pass a reform package, because regardless of what this Congress does, the President, assuming that the Republicans take over the House and the Senate, the President will veto everything. He's not going to allow Obamacare to be tinkered at all. But we can then, in 2012, go to the American people and say this is a referendum on health care in our nation. You've seen Obamacare, we know what it's going to do. You've seen our reform package, you know what it will do. Now you decide. You send us the president and the Congress that you want to pass this, and that's how we will. The final chapter has not yet been written on health care in this country. Not only that, if I could quickly say, there are a couple other ways that the Congress can work with Obamacare. We can work to defund the egregious portions of it. And thirdly, we can't forget that there are 20 states' attorneys generals who are suing the federal government in court right now over that individual mandate as being unconstitutional. And I think that that has a very good chance of passing as well.
Reed? Would it be easier if you just speak from right from the table?
Whatever, it doesn't matter.
All right, there you go. And I
See you right away. I guess we've got 2 minutes here to talk about this a little bit, but you know, healthcare has been a problem, and as a fairly large consumer of healthcare, buying corporate plans for my employees, I understand the tremendous price. We had about 50 families in our plan, and it's expensive, and it has gone up pretty aggressively, pretty much through my entire career, as most of you are aware. So the healthcare system needed reform, and something had to happen. And I think the question, should it be repealed? Well, it should be repealed. They did everything the wrong way. You know, the president often talked about bending the cost curve down, but they never did anything to address costs in the plan. They did address coverage, and by adding a lot of new patients in the plan, according to the president's numbers, 31 million new patients into the system. If you spike up demand, but you don't address supply at all, which the bill doesn't address, adding more nurses, adding more facilities, adding more doctors, adding more supply, you're going to shove prices up. And I think that's part of the reason you're seeing what are going to be, I think, historic increases in healthcare costs in the coming year. So we've got some big problems. We need to begin to address all of these things. Repeal would be the ideal. It really would. It's going to be a difficult thing to do. So initially, I think you try to repeal it, but along with that, you try to defund it. You just don't give the federal government the money to establish these 100+ new federal bureaucracies and hire the 100,000 new federal employees it's going to take to administrate it. But then you have to go back and begin to put fixes in. And I agree with some of the stuff Roger said. And we've talked about this a lot. Really, all of us have. You know, tort reform, it's a little surprising that they didn't address legal reform. I've never been opposed to having patients who've been damaged have the ability and freedom to sue a physician. I've just had a problem with a lot of the frivolous lawsuits, and that's what really drives costs up. You can address it by a simple compromise, and that's having a loser pay provision put in there, so that if you're going to sue a physician and you lose, you pay the cost of it. And just like that, the frivolous lawsuit disappears. And that's where the costs are. If you get rid of the frivolous lawsuit, then you would also begin to, doctors would practice less defensive medicine, and costs in healthcare actually would go down. The healthcare bill didn't address outcomes at all. And really, we need to address outcomes. We need a healthier citizenship. We need healthy Americans. And I think one of the significant things, and it goes to kind of a free market or open market practices, would be to put consumers in charge of their own health care. Right now, we have this system, and it's been in place since the 1950s, where employers have provided health care, and then they would give their employees a choice of one. They would choose the doctors, and they would choose the clinics, and they would choose the plan, and that's what you got. And as a result of that, there was a disconnect that began to happen in the open market between patient and costs. And they really didn't get to see it because it was a prepayment plan. And what we need to do is reconnect those two again so that we can drive costs down. And I've been an advocate for decoupling that relationship, not in a mandatory way, but in a way that we incentivize consumers to take control of their own health care and health insurance. Let's face the facts. Employers don't buy health care. Employees do in the form of lower wages. And so it's easy enough to decouple, and if you would do that, you would begin to get the prices down.
Okay.
All right.
Healthcare.
Queen for a day. You get to make any rule you want because you are now the queen. And you can tell people what our healthcare bill is going to look like.
Scary
You got to
fun.
tell these seniors what's going to happen to them.
Uh-oh.
You got to tell these employers what's going to happen to them.
Pointed right at you.
And now we have to make a decision because it's in your hand.
Okay. No pressure there. My first task in those 6 years back between 2001 through 2006 was to chair a subcommittee on how to reduce healthcare costs for state and local employees. I think it was meant to keep me out of trouble, quite frankly. What I put together was a series of listening sessions all over the state of Wisconsin to first identify the problem. That's what entrepreneurs and business people do, business owners and people who want to solve problems. And what I heard was that there wasn't enough competition, especially with pharmaceuticals. There wasn't transparency with costs. There wasn't transparency with quality. And that's what I wrote with a team of my committee members and coalitions from across the state of Wisconsin, probably 5 or 6 various groups, building those coalitions. What we ended up with was the state's very first competitive prescription drug purchasing pool that saved the state $25 million its first year for just 2% of its state employees, the non-represented state employees. So instead of, all me standing up and saying this is wrong, this is wrong, this is wrong, I want you to see that we need to focus on the what and the how. How are we going to put a plan in place, and how are we going to make a difference? Because I think we can all sit here all day over a cup of coffee or a Guinness or whatever your pleasure is and tell you what's wrong with healthcare and the insurance costs. In May of 2010, May 14th to be precise, I wrote a plan that was published by over 280 business and medical journals across the country, and it was picked up by Fox Business News, which is why Judge Napolitano had me talk about the need to repeal health care. So you're not going to get a policy position out of me, you're going to get a what and a how plan with some results from my background. We need the transparency of costs. Any insurance provider, small business owner will tell you they need to know how much the procedures cost, and you need to be in control of that. We also have quality indicators that we could put on the web right now. The hospital administrators and their associations that worked with me back in 2001 and 2 told me they were available to put you in the driver's seat. We need to worry about top-down management always coming down from government, because when government makes decisions in your personal lives, they're always going to choose wrong. One size fits all does not work for all Americans. We're too independent. We want to make our own choices. We want to make sure that we're making the decisions for our loved ones and not government. So that's why I proposed portability, so that your insurance is not attached with a job. You need to own it. You not only need to own your insurance, you need to own your medical records. If you choose a different doctor because the quality is higher and the prices are lower, then you need to control your own records to take them from doctor to doctor. That's real portability, when the consumer's in charge. Obviously, we need to address tort reform, frivolous lawsuits. We can all talk about that. I vice-chaired the judiciary in the state legislature, and I led various pieces of legislation to put people more in charge of their own lives. I believe that we need to move in that direction. We can stand up all day and say what Obama and his so-called healthcare reform will cost us. One provision is this: mandatory 26-year-olds on your healthcare insurance. And yes, there's pluses and minuses, but all of us will get an increase of 14% because of that one suggestion. $500 billion is taken away from reimbursements for Medicare. Now we'll get into the seniors.